Well, terrific. I want to introduce our next set of panelists. I've just met them, so hopefully I will get this all right down the line. Starting here on the end is Luke Greaves. He's the Executive Director, International Services for the American Red Cross. Sitting next to Luke Greaves is Dr. Lena Wen, who's the Health Officer of the City of Baltimore. Next to her is Josh Sharfstein, you met earlier, here at the School of Public Health. Dr. Laura Herrera is the Deputy Secretary for Public Health at the Maryland Department of Health and Mental Hygiene. And next to her is Dr. Gregory Branch, who's the Health Officer of Baltimore County and President of the Maryland Association of County Health Officers. And they all, in their own way, have been thinking about measles, about this outbreak. They've had to respond to measles and prepare for that here. I'm going to come to you last, Luke, to get the international perspective that you have so well. And start with you, Lena. And I'd like you each just to say in brief a little bit about what are you doing to prepare for measles? How concerned are you about measles in the community that you're responsible for?
Good morning, everyone. So I want to actually start by telling you a story, and it's a story that some of you in this room will know. I started my job about 3 weeks ago, and in week 1, we had a case of suspected measles here in Baltimore City. This was a case of a 12-month-old girl who did not have any travel history, no known exposures, no ill contacts, who had fever followed by characteristic rash, so characteristic that she was diagnosed on site when she was seen in the emergency department, actually here at Johns Hopkins. And we began investigations as we would with any other case of possible measles. We found out that this child actually had, she had received the MMR vaccine about 2.5 weeks prior to her rash starting, but again, had no ill context. And we thought most likely this was a vaccine reaction. However, we could not be certain, and especially with the outbreak going on around the country. And as we talked about, given how contagious measles is, we decided that even if we thought this could be a false alarm, that we would act out of abundance of caution and treat this as if it were suspected measles. And so in the Baltimore City Health Department, our epidemiologists, our doctors, many of whom are in the room actually right now, got together, did contact tracing. This child was actually seen in another hospital prior to her ultimate diagnosis during her potentially infectious period. And so we worked closely with DHMH, with the CDC, to trace down every person who could have come into contact with this child, whether it was in the hospital setting, in the family setting, and so forth. And luckily, it turned out, based on the genotyping that was obtained at the CDC, that this child, in fact, did not have wild-type measles, that this patient ended up having a vaccine reaction, which, as we heard from Dr. Griffin this morning, does happen in up to 5% of cases of patients who do receive the MMR vaccine. We're very fortunate that that's the case, but to us, here in Baltimore City, this was a wake-up call. We are fortunate, too, that in the city, we have a 99% vaccination rate for our public school children. Yet, it's still a reminder to us that Baltimore is not an island, that this could really happen to any of us anywhere, and that we're fortunate to have the collaboration with our state and federal officials and in our city health department with our multiple hospital partners who have been wonderful collaborators in this process.
Thank you very much. Let's talk to one of your state partners, Dr. Herrera.
So in Maryland, we only have exemption for religious and medical reasons, and for medical reasons, you do have to provide documentation. For religious reasons, you do not, and that's based on a case from 1982, and the state made a decision that we wouldn't ask for that. We have seen practically patients start their immunization schedule, and then patients filing that religious exemption and then starting or stopping those immunizations, but that's only 0.1% when we look across all 24 jurisdictions in the state of Maryland. As Dr. Wen said, for kindergarten through grade 12, our immunization rates run between 97 and 99%. We don't have an exemption for philosophical reasons. The measles case has certainly caused us to not only look at our own regulations, but certainly the authorities of the Secretary. If there were an outbreak, what could we do? One of which is the religious exemption. We could say you have to get vaccinated, and if the parent chose not to vaccinate their child, then they would be exempt from school. They would not be allowed to attend school. The other thing we're pausing to look at as well is we have not done a good job in capturing immunization schedule for preschool. So from 12 months to before you start kindergarten, we don't get the reports the way we do from school-age children. So now with the new leadership, at least at the State Health Department, and the relationship that we built with MSD, we are going back to start trying to get those immunization records from preschool children where we haven't historically. We don't have those numbers the way we do for K through 12, and only about 50% of all our primary care providers, pediatrician, family medicine, report in our state immunization registry.
Gregory, at the Baltimore County level and across the counties preparing for this?
We clearly are extraordinarily concerned about the measles and the spread of the measles. So we look at it from a perspective of, let's cease the measles. Oh, you can't hear me. Let's cease. Hear me better now? Cease the measles, C-E-A-S-E. So we can do consultation with our hospitals. We do consultation with our daycare providers, with the schools 24 hours a day. So if anyone has any questions, they can call the local health departments and we can discuss that. We have to educate and we have to train the public and our staff as it relates to any type of measles or measles outbreak. We administer the vaccine to our children in our health clinics, also in our school wellness-based clinics. We do surveillance, we do monitoring all the time, and obviously we have to evaluate and investigate any potential cases of measles. So we look at it from a perspective globally in the local health departments as trying to cease the spread of measles.
Josh, you worked both at the state level and at the federal level. I mean, I'm hearing vaccine coverage rates in Maryland so high. Maryland doesn't need to worry about this?
You know, when I was actually the city health commissioner, there was a big effort to try to roll back some vaccination coverage in Maryland. There were bills in the General Assembly, there were hearings where people were presenting a lot of misinformation. I think that it's really only because of the tremendous efforts of people like Dr. Nguyen, Dr. Herrera, Dr. Branch, that Maryland is in this position, and I don't think we should take it for granted. I was even in a situation where some witnesses were so totally mischaracterizing the very clear reports of the Institute of Medicine that I had to get the president of the Institute of Medicine to write a letter to the state Senate to clarify the record. So, you know, we're really, I think Maryland is a state that has very strong public health, very strong public health leaders, has built a base of trust with people in Maryland that has been able to weather some of the storms. But I think Dr. Nguyen said it right, that it's not an island, that it's constantly going to require the leadership to be thinking about what more it can do as measles is spreading around the country.
Luke, I want to pull you into the conversation. You've worked around the globe trying to increase vaccine coverage rates. What can we learn from that experience that has applicability to what we're seeing in the U.S. right now?
Sure, thank you. It was about 15 years ago where the Red Cross got together. About 15 years ago, the Red Cross got together with CDC, UN agencies, and local health officers from around the world to address measles. We have this effective vaccine. We know that it works, and it just wasn't getting to the communities. Over the last 15 years, we pulled together our resources. We've helped vaccinate 1.8 billion, with a B, children around the world, and have seen measles deaths decline by about 75%. And really the success of this has been organizing national and regional mass vaccination efforts. Over the course of days, over the course of 2 weeks, we get out into the communities and mobilize the parents to bring their children to the vaccination posts. And we see 90 to 100% coverage rates as part of those campaigns. And there really are three things that are really critical towards this, to driving up the demand. The first is removing those barriers, removing the barriers to getting the vaccine. Instead of having the mothers have to travel to the health clinics, the district health clinics to get the vaccine, we're bringing the vaccine to the mothers. We're bringing it to the schools. We're bringing it to the places of worship. We're bringing it in Africa underneath the big tree in the village. Where the parents are, where the children are, is where we're bringing it. We're also making the vaccine free of charge, of course, to the families. The second is that we're taking the message beyond just the health professionals. The health professionals do a great job in educating and providing credibility to this, but we also have volunteers who are going door to door and sharing their stories, engaging in that conversation that we heard of earlier about the importance of vaccination. We're engaging social media, we're using community leaders, religious leaders, local celebrities, to get the word out. And we know that this peer-to-peer, this localization of the message works. In many cases, it actually increases the coverage rate by 10 to 15%. And as we heard earlier, that is critical with measles, where you need to have this 90-95% coverage rate. And then the final is we've added incentives to providing supplemental health interventions when we provide the measles vaccination. In Africa, we're handing out malaria bed nets. We're giving out polio vaccinations. We have this double benefit of not only addressing additional health issues, but it also serves as an incentive for the parents to bring their children in. And when you're when you're reaching 90 to 100% of every mother, every child in a country, it's an amazing distribution network that we have to take advantage of.
A question I want to ask to a couple of you. When I see the presentation of vaccine safety often in the media, it's often science versus a mother and her child and their personal experience. Lynn, I'll start with you. How do you avoid, or how do you deal with the incredible strength of an anecdote, of someone's experience, when you're trying to make a case about vaccine safety and why someone should vaccinate their child?
It's hard. So much of what we do in public health is hard. And so much of it is you don't hear the good things that we do, right? You hear the news about public health when outbreaks happen, when there are diseases, when there are bad consequences. And public health often isn't about what are the things that we can do to improve health, but actually that's what we do every day in surveillance and teaching and so forth. I'm a practicing doctor as well, and I've had these very difficult conversations with patients where no matter what science we present, that power of the story, the power of the anecdote is what overrides at the end of the day. But you know what, we can do the other way around too. We can also present anecdotes. One of the reasons, I think, as to why our parents now are not vaccinating their children as much as before is that we haven't seen, our generation of doctors, our generation of parents, we haven't seen the scourge of measles. We haven't seen the ill effects of polio. We haven't seen, we've become so successful at vaccination and at public health that we haven't seen what happens when people die, when there's fear and uncertainty and illness and tragedy that's happening in our communities the way that our predecessors did. And so bringing these stories back, not as a scare tactic, but to explain, for example, the numbers, even the stories that we heard earlier from many of our panelists, the millions of cases of measles that occurred, the hundreds of deaths that occurred every year. Having those stories also helps to counter the perception of a celebrity or someone who says that, well, measles vaccines or some other vaccines are not safe for some reason. And I do think that it's the genuine conversations that are helpful. I encourage my patients to ask me anything. And it's that trusting relationship that has to be developed. So the questions themselves are not bad, but we have to be able to counter the anecdotes with our own stories that are powerful as well.
Josh, a question for you, putting on your old FDA hat. Mm-hmm. Vaccines, when they're licensed, they're tested in thousands of children, maybe tens of thousands of children. Then they're administered to millions of children. What is the FDA doing to ensure that very rare side effects or ill effects of vaccine are detected?
Sure.
Just tying into the whole people's confidence in the vaccine safety.
Absolutely. No, that's a great question. Before I turn to that, I just wanted to add one quick thing to what Dr. Wen said, which is I think it's a bit of a gift to public health that this latest outbreak happened at Disneyland, because I think it helps with the conversation with parents. It is a story that can be told to parents that Disneyland became unsafe because people didn't vaccinate their children. And I think it's a different way it's a way of actually crystallizing the benefit to the community of vaccination. To your point, there are different components of the vaccine safety system, and I certainly have found that the people who are working on vaccine safety care very deeply about making sure that they're getting it right. There's a lot of analysis that's done on the large trials that are done prior to licensure. And then there are systems for catching adverse events, even rare adverse events, and assessing whether they may be linked to the vaccine or not. And when they are linked to the vaccine, even if it's a couple in a million cases, that gets assessed very seriously. If you look at what happened with a particular vaccine against a diarrheal disease called rotavirus, that vaccine was actually withdrawn from the market just for a very small increase that scientists and the FDA found to be a real increase in the rate of an intestinal blockage. And so you see both reporting of events, but also systematic studies where they're looking for rare events that could be happening. I think Dr. Salmon talked about the fact that there are new data sets that happen in large healthcare organizations that are being looked at for problems. There are a lot of people, very, very smart people, whose job it is to comb through all the evidence, evaluate every potential problem that's come up, assess whether it's real, and then take action. And having worked directly with those people, it gave me even more confidence in the way that vaccines are regulated.
This next question for you, Laura. Maryland, you were saying, only has a religious exemption.
And a medical exemption.
I'm sorry, only has a medical and religious
Correct.
exemption. How do you avoid a situation where people's personal beliefs, in a sense, become their religion, and that category starts to capture that group?
So we haven't seen an increase in the religious exemption. It's been pretty steady going back a couple of years at 0.1 to 0, 0 to 0.1 across all jurisdictions. I think to the points that were made already, it's, we continue to work with the delivery system and working with the pediatricians and the family medicine and other providers that are educating their patients about why immunizations are important. The health department pushes out information, not only through the different medical academies, the Maryland chapter of Academy of Pediatrics and family physicians, but we push out information with MSDE out through the schools to parents and to the leaders of schools about why immunizations are important. So that information continues to be put out, and based on that, we have not seen an uptick if individuals who maybe philosophically don't agree with the immunizations now using this religious exemption. So, and I think that's just that all the players at the local level, the local health departments, our federal partners pushing out information that has worked for us in Maryland.
If the measles outbreak came to Maryland and got large, what emergency powers do you have to compel vaccination? And would you ever do that?
So yes, we would do that. For the medical, we would ask providers to look at those individuals, whether it was a permanent medical exemption or a temporary medical exemption. And for the temporary medical exemption, if those individuals had not been vaccinated, to see if the window for them to be vaccinated has passed, get those children vaccinated. And for the religious exemption, the emergency powers trumps the religious exemption. So we would mandate that all children that fall in that category be exempted. And if they wouldn't, if the parents refuse, we can exempt them from school and have them quarantined for up to 21 days.
Thanks. Gregory, question for you. Some parents who are vaccinating their children raise the question, yeah, you're keeping these children out of school, but what about the parks? What about the mall? What about other places where children congregate? How do you ensure that vaccinated individuals are safe in those settings?
Well, obviously, if someone is not vaccinated, we cannot ensure that. we try our best to be able to decrease the amount of communication and communicable diseases within certain settings and environments. However, we're not going to have a person not be able to kind of go outside or tell a child they can't go to a park. But every child who is not vaccinated really has the increased risk of being able to come down with that wild disease. And obviously there are a lot of complications to that. So we have to continue to address the families by understanding and talking with them about what their concerns are, but continue to push the underlying point of vaccinations are imperative and very important and will save their child's life.
Lena, in some states, a parent can go online and look up to see what the vaccine coverage rates are in their child's school. Is that something available here in Baltimore?
To look it up online or
Yeah.
to...
California, you can plug in your
Right.
school name. I was having fun with this, finding schools with 50, 60, 70% of kids not vaccinated against measles.
Well, the good news in Baltimore City is that our vaccination rates in public schools are over 99%. And that's one of the reasons why we have not had any case of measles here, at least in over 10 years. So I don't know that we can look it up by school, but the overall vaccination rates are so high. And we also provide, as Dr. Branch was saying too, our efforts include not only surveillance, but also providing vaccines to all of our children who are underinsured or uninsured, again, to ensure, allow them to protect themselves and also to protect our wider community.
Laura, this question for you. Are exemption rates measured in Maryland in private as well as public schools?
They are both. We get K through 12 reporting of both. And you can get it at the county level, just not at the school district level.
Have you seen any evidence of clustering of low vaccination in school, even within your 99%?
No, we went back a few years, given the recent rule-out case in Baltimore City, looking at the medical and religious exemptions, and both have been fairly stable for the last few years when we looked by jurisdiction.
Luke, for you, one of the issues that we've been hearing about here in the United States is no one sees measles, and so the demand side for vaccine goes down. People aren't worried about diseases they've never seen. Your experience in Africa, how much was that people didn't want the vaccine versus couldn't get something that they really, really wanted?
Right. I mean, it's a bit of a mix. I mean, there's definitely the access issue. There's definitely the access issue in much of Africa and Asia. India right now has the highest measles rates in the world. And part of this was also fears. While it wasn't autism, the fear is of other local cultural issues. I remember being in Kenya last year where we were administering some measles vaccinations, and the community was very fearful that if you injected one of their children, they would be possessed, the demons would come out through them. So we have to address this at a community by community level. But they very much are present around the world. And what we're seeing is in Africa, where we've had such great gains over the last 15 years, the same thing that we have in the United States is people haven't seen measles in their community in so long. We have a new generation of parents that are there, and they opt not to go and get their child vaccinated. So we're seeing a resurgence of measles in many parts of the world.
Josh, again, putting on a federal kind of hat here, no state exists in a vacuum. You can kind of think of Maryland as that vaccinated school and child in the classroom that may be surrounded by kids who've decided not to vaccinate. A lot of people who live in Maryland work in other states, and you have people here who may be immunocompromised. They're impacted by people in other states who don't vaccinate. Should vaccination be something that's at the state level to determine, or should it be something determined at the federal level in terms of requirements?
I think, generally speaking, it should be at the state level. I think that's where there is the best chance of getting a policy that is strongly supported in the different local areas. I do think, though, that in the case of a serious outbreak, I think the federal government's responsibility is to protect the health and safety of the people of the country. And I think, I'm sure at CDC, there are plans for what could happen if measles really explodes. I think that it may get to a point where there are so many cases that the federal government needs to step in, like it does in other situations, like it could do in the case, as we were talking previously about Ebola, there'd be a scenario for the federal government stepping in. I think that is partly the federal government's responsibility to be a safety net around public health.
I think we are just about out of time. If anyone had a last comment, otherwise we'll take the few minutes to switch off for our last speaker.
Let me just say, to your point about looking up the school vaccination rate online,
Yeah.
I'm not sure what I think about that. I think I'd like it, you know, I think Dr. Wen said if you looked it up in Baltimore, you'd see 99% for every school. The implication is, well, just go, you know, if you don't like vaccines, go find a school that does where nobody vaccinates, I think, you know, and I think the point here, it's beyond transparency. It's beyond just, let's just see what people want to do or their own choice, that there is just such a huge risk to health, to having that kind of concentration of non-vaccinating that I would probably prefer a stronger public health effort around vaccination than kind of an internet-based transparency solution.
So you don't feel a parent should know whether the school they're sending their child to has a low vaccination rate?
I think that the focus should be on not having schools with low vaccination rates. And I think that there's a potential counterproductive aspect of a system like that. So I'm just saying that, you know, it's not about so much what the parents should know, but where public policy efforts should be addressing measles. It really has got to be focused on making sure there aren't schools where you could have an outbreak where, you know, the kids who have HIV, have cancer, and or just by a roll of the dice get one of these horrible complications that we heard about.
Thank you all very much.